Hi, my name is Wanda. I'm going to be your nurse today. Can you tell me your name
My name is Kagan Dupree,
and your birth date?
3/13/87.
Okay. Now let me just close the door so we'll have privacy and get my hands washed.
Okay.
Okay. So Miss Kagan, would you like to be called Kagan or Miss Dupree?
Kagan's good.
Okay, Kagan. So today we're going to be doing an assessment of your head, and I'm going to inspect your head and your face, your eyes, your ears, your nose and your mouth, and I'm going to check your glands and your sinuses. Is that okay if I touch you?
Yes, that's fine.
Okay. So the first thing we're going to do is I want to just look at your head. Okay.
My hair's dirty, don't look at me.
Okay, I'm inspecting you. I'm going to go ahead and put on some gloves. Now that I touched your head. Okay, your head looks symmetrical. Do you have any pain in your head?
I'm having a little bit of a headache on this side.
Okay, and how would you rate that pain?
About a 4.
Okay, is it typical to have headaches? Do you have them a lot?
Sometimes.
Okay, so let me just go ahead and feel your head. Okay. Do you have any pain on your head or just in your... Okay, so your head is fine. I don't see any balding or thinness. No pain, and you're symmetrical, so that's good. So now I want to go ahead and take a look at your face for the size, shape, and configuration. And everything looks symmetrical, and this is in line with your eyes. Let me see, your earlobes are not attached. Okay, and I don't see any rashes, no excessive hair. You do have some freckles, but that's okay. And I don't see any moles. And do you have any tenderness other than right here on your face? Okay. I want to go ahead and touch you here. Does that hurt? Okay. These are your temporal arteries, and they're elastic, so that's good. Now let me go ahead and touch you here. This is your temporal mandibular joint. Can you open your mouth for me? Good. Close it. I don't feel any clicking or popping. Did you have any pain when you did that? Okay, good. Now, let me go ahead and inspect your neck. So I'm going to shine my light from the side, and I'm looking for swelling or enlargement. Do you have any pain in your neck? Okay, good. Well, you're symmetrical in your neck, and I don't see any abnormal findings. There's no discoloration. Okay, and I want to inspect your thyroid. So can you take a sip of water for me, please?
Yes, ma'am.
Thank you. Okay, I saw it move up and down. Do you have any pain? You already told me you don't have pain there, so that's still fine. Okay, so I'm going to come around behind you, and I want to look at your vertebrae.
Okay.
Let me see. Can you look forward for me? Okay. I see you're C7, and that's a good sign. Okay. That's noted. And so let's do your range of motion. Can you put your left ear to your left shoulder? Okay. Smooth. Go to the other side. Now come forward. And then look to the ceiling for me. Okay, did you have any pain when you did that? Okay, well it's smooth and controlled. So I'm going to go ahead and palpate your trachea. I'm going to place my fingers right here in the little notch. Okay, and your trachea is symmetrical. I'm feeling your tracheal rings in its midline. Okay, and now I'm going to palpate your thyroid gland. Okay. Now, if you had any swelling or tenderness there or masses, I would want to listen for a bruit, but you don't have that, so I'm not going to listen for that.
Okay.
I don't think that's necessary today.
Okay.
So we're going to go ahead and palpate your lymph nodes.
Okay.
Okay, so you have these lymph nodes here in the front on your frontal sinuses. Do you feel any pain there?
No.
Okay, now I'm going to come down here to your mastoid. Any pain there?
No.
Okay, good. So there's no swelling, there's no enlargement, and there's no tenderness. Okay, so let's go on and do your lymph nodes. So do you know you have lymph nodes kind of all over the place? So where we're going to start is in front of your ears. Feeling any pain or tenderness there? Okay, I'm going to go behind your ears. Tell me if you feel any pain anywhere, okay? Now I'm going to palpate behind here in your occipital area.
That feels good.
Oh, okay. I'll just keep right on doing it. Okay, we're going to come on around under your chin. Okay, and then down the side. Okay, you even have nodes here in your clavicle, so we're going to go ahead and palpate that. Okay. Any pain anywhere? Okay. So I don't see any enlargement. I don't see any tenderness, and I don't see any swelling either.
Okay.
So let's move on to your eye test. Do you wear glasses?
I do not.
Okay, so this is a Snelling eye test, and I'm going to stand 20 feet back.
Okay.
And would you please take this eye cover, and I'm going to have you do one eye at a time and read the smallest line you can see.
Okay. First, do the small one.
Go to the smallest one you can see.
F E Z O L O F T B.
Okay, now let's do the other eye.
Okay, hold on. F E Z O L O F T D.
Okay, Ms. Kagan, you have 20/20 vision.
Okay.
Okay, so we're going to do another visual test.
Okay.
Okay, and this test is, we're going to hold this 14 inches from you, and I want to test your near vision, okay?
Okay.
So, do you wear glasses?
I do not.
Okay, let me see. 14 inches. So we tested your distant vision, and that was perfect. So let's see if you need to start wearing glasses yet.
Okay.
Okay. Okay. So, can you read the smallest line you can see at 14 inches?
Okay, before beginning a physical assessment of a client, the nurse should first.
Okay. Very good. Okay. So now I'm going to sit eye level with you, Ms. Kagan, and we are going to test your visual fields, okay? So
Okay.
hold this card.
Okay.
I'm going to come sit eye level with you,
Okay.
and I want you to cover your left eye.
Okay.
I'm going to cover my right eye, okay? And so I'm going to pull my left finger up to the side and tell me when you see it.
I see it.
Okay, let's do the other side.
I see it.
Okay, you flying colors today. So your peripheral vision is intact, and I'm going to move on to your corneal light reflex.
Okay.
And so what I'm going to do is I'm going to take my pen light. I'm going to be about 12 inches from you.
Okay.
Okay, and so you know you have little red flecks in your eyes when the light shines on them. I want to see if they are parallel.
Okay.
So, or if they're in the same spot on each one. So, I'm going to, here I come. Okay. And they are parallel. Okay, so now I'm going to have you take this opaque card once again, and you're going to look straight ahead. Okay, and you're going to keep both your eyes open, and I want to test to see if they do the same thing on each side. Perfect. Perfect. So, your eye movement was smooth and symmetrical.
Okay.
Okay, so we're going to do the position test now, and I'm going to move this in about 5 or 6 different positions. I want you to keep your head straight. Only follow my pen with your eyes. You like that happy face?
Yeah.
Okay, here we go. Okay. Your movements are smooth and controlled, Kagan. I don't see any problem with your eyes so far. Do you have a history of eye problems?
No, I do not.
Okay, good. Do you have a family history of eye problems?
My grandfather had cataracts. And
Oh. Was he... We won't get into that. That'll be another assessment. Okay, so I'm going to just go ahead and inspect your eyelids and your eyelashes.
Okay.
And, let me see. Close your eyes for me. Your eyelashes are not sparse. They're even. Open your eyes. Okay. And the... Okay, let me continue. The sclera is white. Close your eyes for me. They close completely. I don't see any swelling or drainage. And they look symmetrical. I don't see any protruding. Okay, so now we're going to inspect the bulbular conjunctiva. And I want you to keep your head straight and look to the side. Okay, now look to the other side. Okay, now look up to the ceiling. Okay. Good job, Miss Kagan. Okay, so do you have any eye pain at all?
no.
Okay, well, there's another test we can do, but since you don't have any eye pain, we're not going to do it because it's kind of very uncomfortable and would involve inverting your eyes out and all that. We don't want to do that. So I'm going to go ahead, and you have lacrimal ducts here. I'm going to press on it. Do you feel anything, any pain? No? Okay, good. There's no drainage, no redness. So we palpated that. Now we're going to look at the corneal lens for transparency. I'm going to shine my light again, okay, to inspect your lens for opacity. Opacity? I think I butchered that word. Go ahead. Okay. And so I'm going to get very close to your eye now, and I want to see how sharp the edges are defined. Oh, they are sharp. Okay, sharp defined edges. And your ovals, they're oval. Your disc is oval, I mean. Okay, now we're going to move on to your ears.
Okay.
So let me just look at your ears. Okay. Earlier I noted that your lobes were not attached. Okay, they fill your auricles. And they are in line with your eyes. We mentioned that earlier. Okay, I got a little ahead of myself. They're bilaterally equal. Okay, so let me just palpate these. Any tenderness? I'm going to feel your mastoid process. Okay, no tenderness there? Okay, let me get my otoscope out, and we're going to take a look inside, okay? Let me see. I'm going to pull up and back. I don't see any drainage or redness, anything going on in your ears that I need to know about? No pain? Okay. Now let me get a little closer look at that tympanic membrane. Ooh, it's pearly gray. Nice. And it's patent. Okay. So we're going to move on to some other tests. Now, this is called the Weber test.
Hey, how are you doing?
Can you just let me do it because I'm making a video? I mean, right? Just drop it off. Pizza. Hold on. Dang. Interrupt me. I love you, Miss Stamey. Thank you. I'm sorry.
You're fine. Have a good night.
You too. Work. Okay.
Okay, back on.
So where were we? We were doing the Weber test.
Yes, the Weber.
Okay, so I'm going to tap this on the back of my hand.
Okay.
I'm going to place it in the center of your head.
Okay.
Okay, so I want to know if you're hearing it in both ears or just one, okay?
Okay.
All right.
Both.
Okay, good. So that was our Weber
Okay.
test.
Okay.
Now we're going to do the Rhine test.
Okay.
And so I want to hear the conduction, like air conduction or bone conduction. So I'm going to tap it and I'm going to place it on right here. And tell me when you stop hearing it, okay? And then I'm going to place it in front of your ear. And then tell me. And we're doing both sides.
Okay. I can hear it. I can hear it.
Okay.
Let's say stop me. Stop. Stop.
Okay.
I can hear it.
Okay. So that was our Rhine test.
Okay.
Did I get ahead of myself? Okay. So there's another test I want you to do, and I don't know have you ever heard the Valsalva maneuver? That's where you kind of bear down. So I want to take a look at your tympanic membrane. I'm backtracking a little bit while you do that. Okay.
Okay.
Okay. Now do it on this side for me. Okay. I saw a little flutter. That's perfect.
Okay.
Okay, so we want to do, there's another test that I want to do, and it's called the Romberg test. And so what you're going to do is testing your equilibrium. So you're going to stand up with your hands beside you, with your feet together, and you're going to close your eyes for 20 seconds. But I'm going to put my arms around you, but let's turn around. So if you start to feel dizzy, don't worry, I'll catch you. Okay, ready? Close your eyes. Okay, Miss Kagan, you did perfect. You passed that test as well. No dizziness. Good balance.
Okay.
Did you feel okay when you did that?
I felt okay.
Okay, awesome. We're almost done. So I'm going to go ahead now and change my gloves because we're going to look in your mouth now.
Okay.
And these hands have already been all over your head.
Okay.
So let's put on some clean gloves. Okay. I'm going to be inspecting your lips. Do you have any mouth sores or ulcers or anything going on?
No.
Okay.
I do have a little bit of a sore throat, so I don't want you to get too.
Okay. Well, I better put my mask on. Okay. So I'm going to inspect your lips. Okay. Let me look at everything's pink and moist. I don't see any fissures or cracking. Looks good. The color is even and good. And your jaw is in line. There's no, can you back down for me? Okay. It's even. There's no deviation there. So let me look at your teeth. Okay. So let me count these teeth. Okay, so I see 28 teeth, okay? You have 28 teeth, and they're pearly white, and they're smooth, so you have really nice teeth, Kagan. So I want to go ahead and look at your gums.
Okay.
Sorry, I have to put my hands all up in your mouth. Okay, your gums look nice. Sorry, Kagan. Okay, so I have a tongue depressor here.
Okay.
And I'm going to go ahead and look at your throat.
Okay.
Okay. So say ah. Okay. I see your uvula. It's midline, and your tonsils are 1+.
Okay.
So that's good, and they're
Okay.
symmetric.
Okay.
Okay. So that one's yours.
Okay.
I don't want to get all up in your business. Okay, I'm palpating her tongue. I'm not really going to do it.
Okay.
But I don't see, her papilla is there, and her tongue is smooth and pink, and everything looks within normal limits. Okay, let me palpate your nose. Do you have any tenderness there?
No.
Okay, so now I want to go ahead and get my scope and look inside your nose.
Okay.
Okay, we're looking inside her nose, and I don't see any deviated septums. The color is pink, and I don't see any polyps. So I want to test your patency. I'm going to hold one side. Can you breathe in for me? Okay. Can you breathe in for me? Okay. So your nares are patent, and there's no tenderness there. And we already palpated your sinuses. Okay. So, Miss Kagan, do you have any other concerns for me today?
I do not. You've
Okay.
been wonderful.
Thank you.
Thank you.
Come back and see us real soon.
I will. Okay.